Yo, what's good, everybody? It's Daniel back with another video. So today we're going to be talking about aortic stenosis, which is one of the most high-yield valvular diseases for step 1. And this condition shows up on the MBME exam because it combines murmur recognition, pressure overload physiology, left ventricular hypertrophy, and heart failure. And I'm hoping by the end of this video that you guys will kind of have a better understanding of aortic stenosis. All right. So, a quick overview. Aortic stenosis is a fixed obstruction to blood leaving the left ventricle, and because blood has difficulty exiting the heart, the left ventricle is exposed to chronic pressure overload. And over time, this leads to left ventricular hypertrophy and eventually diastolic dysfunction, also known as heart failure with preserved ejection fraction. And the mechanism is that aortic stenosis is like the narrowing of the aortic valve. And so this narrowing will cause an increase in resistance to blood flowing during systole. And as a result, the left ventricle has to generate a higher pressure to eject the blood, which obviously will increase afterload. And this increased afterload is the key driver of this disease. And like I mentioned, because the valve is narrowed and the left ventricle has to generate a higher systolic pressure to overcome this obstruction, the chronic pressure overload will cause the ventricle to adapt structurally, and this will cause the ventricle to adapt to a concentric left ventricular hypertrophy, meaning that the wall thickens inward rather than the chamber dilating. So in the previous video we mentioned LVH, and it's a similar pattern of growth. The cardiomyocytes will the sarcomeres will grow in parallel and not in series, which will increase the wall thickness and decrease the wall stress. And some of the causes of aortic stenosis it's usually related to age, related calcific degeneration, and it's typically seen in elderly patients. But you can get a congenital bicuspid aortic valve, which can lead to earlier calcification and stenosis. Rheumatic heart disease is also a cause, but it is definitely less common than the other two. But so just know that aortic stenosis is fairly normal in older people, and it's usually like pretty mild, it's pretty chill. But then once you have a bicuspid aortic valve, which is congenital, which is it's autosomal dominant, then you will have aortic stenosis popping up in patients who are a lot younger than what you would expect. And some of the symptoms include syncope, angina, and dyspnea on exertion. And so you can kind of see SAD, so just remember SAD is for aortic stenosis. And just look for, if you're really confused, you're reading the question statement, but just look for if the patient has some type of systolic murmur and chest pain or fainting. So chest pain, angina, and then fainting, the syncope. Just look for that, and that's usually aortic stenosis, unless you're giving something that's completely not aortic stenosis, But that's usually the case for aortic stenosis, so just kind of look for that. And so the syncope occurs because you have, because the cardiac output cannot increase during exertion due to the fixed obstruction at the valve. The angina occurs because the hypertrophied myocardium has increased oxygen demand while coronary perfusion is reduced. And the dyspnea results because you have diastolic dysfunction and elevated filling pressures, which can cause pulmonary congestion. So some of the diagnosis and tests that you'll see So on physical exam, you'll see that aortic stenosis causes a crescendo, decrescendo systolic ejection murmur. It's best heard at the right upper sternal border, and it classically radiates to the carotid arteries. And I feel like that's something you should remember, that it radiates to the carotid arteries. I feel like that's like a pretty big giveaway that it is aortic stenosis. Um, and yeah, and um, it also comes with an ejection click, but and just memorizing that it's a mid-systolic murmur is not really going to help you. I think you just have to know that aortic stenosis is some type of systolic murmur with an ejection click. But you know, they're not going to give you ejection click all the time. So, but if they do give you the ejection click, it's aortic stenosis, right? So, and then it also has slow rising pulse, which you shouldn't get confused with aortic regurg, which has a bounding pulse. And some of the maneuvers, so the murmur intensity in aortic stenosis depends on the flow across the valve. And so, squatting will increase preload and therefore stroke volume, which will increase the flow across the stenotic valve, which makes the murmur louder. And Valsalva, on the other hand, will decrease preload and therefore reduce the murmur's intensity. And hand grip actually increases afterload and therefore decreases forward flow, which also reduces the murmur. So you can kind of think of it as like anything that increases preload will increase the murmur. And this is just a sample question that is very based on an NBME style question. So I'll give you guys 5 seconds to kind of read it and answer it on your own. You can pause the video if you want to. Okay, so 5, 4, 3, 2, 1. Okay, so yeah, the answer is congenital bicuspid valve. So let's read it together. So, which of the following is the most likely underlying cause of this patient's condition? A 46-year-old man presents to the emergency department after a brief episode of lightheadedness while climbing stairs. He reports a 1-year history of progressive exertional fatigue and intermittent chest tightness that resolves with rest. Okay, so we already have the chest tightness and fatigue, and we also have the lightheadedness. So SAD, right? He has no history of hypertension or diabetes. Oh, also the age. The age is like he's like kind of mid age, like middle age. He's not really old. Physical examination reveals a harsh, late peaking systolic murmur heard best around the right upper sternal border. Okay, and the radiation to the carotid artery. So that's already like a giveaway that this is aortic stenosis. And because he's a pretty young guy, we're thinking that it's more of the congenital bicuspid valve. Okay. So carotid upstrokes are delayed. Simultaneous pressure tracings obtained during the cardiac catheterization demonstrate a markedly elevated systolic pressure in the left ventricle compared with the aorta during ventricular ejection. So I think, obviously this last sentence is very important because it's comparing the left ventricle pressure to the aorta and saying that the pressure in the left ventricle is higher than the aorta, which is not normal, obviously. And so with all those clues, with all the, if you read it from down to top, starting with the last objective finding, which is the simultaneous pressure sentence, and then you read up to even just all this physical examination, it pretty much points you to aortic stenosis. And because the man's age is not old, and like most then like, so the man's age is not old, and therefore you would think it's more of a congenital bicuspid valve, rather than B, which is, B is the most common cause of aortic stenosis, but it's seen in elderly patients, so patients greater than 65. So that's why it's not B, and the rest are just like kind of like random fillers. Um, but yeah, so last slide, just watch for older patient. It's usually an older patient. That's the thing. It's like that's the most common cause of aortic stenosis. So that's kind of why I'm saying, look for the older patient, and look for the harsh systolic murmur. Plus or minus ejection click, as in, you might not always get the ejection click, but if they do give it to you, then there you go. Like, they just gave you a free point, right? Look for the calcified valve and look for left ventricular hypertrophy, because these two go hand in hand essentially. But yeah, that's all for this video. Hope you guys enjoyed it. Yeah, let me know if there's any questions about it, or anything else. Appreciate you guys watching. Deuces.